Okay, so this is a quick training taking a look at how we use tube feeding to support the treatment process at ViaMar Health. This is just an opportunity for you to get started on educating yourself for how we use tube feeding in the support of our clients, but not a guideline. So you will want to check out additional documentation. You'll want to take a look at our policies and procedures. And if you have specific questions, you'll want to direct those to a dietitian, the nutrition director, or the medical director. So the traditional needs for utilizing tube feeds is that a lot of times people can be in medically compromised conditions, such as in the ICU, where they may be unconscious, dealing with a disease that gives them significant GI distress. They have any kind of breathing or swallowing issues that just won't allow them to take food down the traditional path. Maybe they have oral issues, dental issues that are pretty extreme and require some surgical work or those types of things. So one alternative to having to chew and swallow your food is to have a small tube inserted through one side of your nostril. And as you can see here in this image, so it would go up one side of your nostril and then back down your throat, down your esophagus, and then it would stop right in your stomach. So what we will be able to do at ViaMar Health is offer this as an opportunity to hopefully enhance the food that they are already consuming by mouth by offering them more consistent energy for the body to utilize, metabolize, and digest throughout the day. So, as I mentioned before, it will go in through one side of the nose, it will go down the throat and the esophagus into the stomach. And then once it is placed there by our nursing staff, the client or the patient will then be sent to the hospital in order to have an x-ray. This x-ray will confirm that the tube has in fact stopped there. So we're not putting a camera on it or anything like that. We're putting it down with a good process for how to estimate location, and then we need to send out to make sure that that is where the tube is located. Additional people that might require the use of tube feed would be somebody that is a young child, like pediatrics or geriatrics, where they might be dealing with different situations where they have failure to thrive and require nutrition. Additionally, there are other types of tube feeds. So we are doing a traditional nasogastric tube feed, meaning it goes through the nose and ends up in the stomach. But there is also a potential for having the tube move through the stomach, and it would actually stop in the jejunum, which is a little bit further down the small intestinal tract. And that is for people that are struggling with the breakdown process and the digestive process. So our clients won't be dealing with that, but I just want to let you know there's a few different types out there. The third type that you may potentially hear about would be a PEG tube. So the PEG tube is something that is actually placed as a port on the side of the stomach region, and it's external, and you can feed directly into that port and it will go into the stomach. We probably won't see a whole lot of that, but on occasion, we could have a client come in with a PEG option. And that's really for a chronic long-term issue with some sort of a component of the process of getting food digested and down. So this is a great little diagram that kind of takes a look at the two different types of nutrition support that are offered. So one of those is enteral nutrition, which is the type of nutrition we offer through having a tube feeding option. And the other one is parenteral nutrition. And that is a type of IV nutrition where the food is already broken down and it essentially goes into the body already in the absorption form. So we're not going to be focused on that. We are not going to be dealing with the parenteral nutrition track. So we want to start here and ask questions, is the GI tract functional? For the majority of our patients, it is going to be. So the answer would be yes. For the majority of our patients, they can eat by mouth. So we would want them to eat normally. However, certain things can come up. So let's say they can eat by mouth, but the option is that they're refusing to eat by mouth, or they are having some struggles with swallowing, or they can eat by mouth, but the GI discomfort that they have is so strong that it's kind of making it so the desire to want to eat is low and the fear of eating becomes really high. So as you can see, it doesn't fit perfectly into this chart, but again, just some helpful ideas for how we will approach this as a dietary and as a medical team. So how long is a person going to be needing additional nutrition support? For more than 4 weeks, you will want to take a look if gastric feeding is appropriate, because we don't want to be using a nasogastric feeding tube for a long period of time. It just increases potential for infection and can lead to other issues. We want to continue to use the chewing and the swallowing mechanisms in the body. So if we're going to be required for more than 4 weeks, then there are some other options. I mentioned the J tube and the PEG tube previously. But let's say our goal is short term, offering support, and so we're less than 4 weeks. Is gastric feeding appropriate? If yes, then we would do an NG tube, which is most of the time what we're going to do. If no, there are some other options, but that would be the case for us. So I just want you to get a feel for how we utilize this as an option for nutrition support. So a little bit of a tube feeding overview, in that this is not our first resort for nutrition support. In fact, we want to look at this as a last resort for nutrition support. If the GI tract works, meaning they can chew, swallow, digest, absorb, and metabolize food, excreting things that aren't needed, we want to make sure to use it. The idea with the GI tract is very similar to what happens with our muscles, considering our GI tract is a lot of different intertwining muscles. The idea behind it is we want to keep using them so that they stay strong. So if you stop lifting or stop exercising or stop working out compared to how much you used to, you'll find that your muscle size depletes a little bit. Well, the same thing can happen here. Aside from that actual muscle memory, muscle function of the GI tract, the longer you go without eating certain foods, the more difficult it actually can be to once again begin digesting them. That doesn't mean that you can't digest them. It just means that if your body hasn't gone about digesting those foods for a long period of time, the enzymes might not be readily available, and the process for digesting may be a little discombobulated, which can cause GI distress. So the longer a person goes without eating, or without eating a certain number of foods, meaning food variety, the more difficult it can be to digest those foods and the more discomfort there is. So food restriction combined with eating disordered behaviors such as purging, binging, laxatives, all of that kind of stuff, all serve to increase GI distress. And so we can't avoid that, right? We're going to have to feed them through those difficulties, but we want to do it in a way that is most comfortable and most supportive. Not overly comfortable, but most supportive and most comfortable. So it is most ideal to have a client eating and doing the regular meal planning stuff on top of having that tube feed happening. So yeah, that would be kind of the gold standard ideal for how we would use tube feed in our treatment center. Somebody who just has a lot of re-nourishing to do. And again, not just weight, but just overall nourishment and nutrition. And they just don't quite have the capacity to tolerate the amount of fullness that would be required through food. So if we can give them a little bit of additional support that's pretty easy to digest and it's easy for your body to absorb and it doesn't create that fullness, why wouldn't we offer that, right? So again, I've already talked through a few of these different reasons. And sorry, I keep looking over here. I have another screen over here as well. But some reasons that you might need the tube feed is you're not able to eat due to strong fears, due to extreme amounts of fullness. So maybe you're eating, but just not to capacity. But there can be a number of other reasons. Trauma related to food, an inability to swallow. I have that down here. Another reason that the tube can be used, and again, this is not in all situations, is as a mechanism to help stop purging. Purging behaviors and self-induced vomiting can be a learned behavior, meaning again, there are muscles inside of the connective tissue of the esophagus, and those muscles can learn how to bring food back up just as we've learned how to swallow food down. And so over a long period of time of that self-induced vomiting behavior, through small contractions of some of the abdominal muscles or through simply bending over in the right way, it can be very easy to purge. And for some people, breaking that cycle can be really difficult. And in some instances, inserting a tube in order to stop that trigger from happening can be a helpful way to encourage that process. Sometimes a tube can be really helpful when there's timing issues, meaning we know we have a very clear set of days to get as much nourishment in as possible. And of course, we want to do it in a safe fashion. That's always what we will do. But that could be a really helpful, useful motivator to push a little bit harder, especially if there's a good long-term treatment plan outside of that time frame that we are given. If they also are having poor fluid intake, or there are some significant and clear nutrition deficiencies that just might not be clearing themselves up fast enough, the tube can be very helpful. I previously mentioned there can be extreme situations with oral issues or swallowing issues where the tube can be helpful for allowing some healing. And then again, there may be some medical conditions that are present, and maybe that significant GI distress is just calling for some sort of additional support. Now, I talk about this as if it's a totally reasonable, normal, easy thing to do. And in fact, having a tube put in your nose is definitely very invasive, and I mean, you could imagine uncomfortable. Now, not everyone feels that way, but I would just say that in general, that it is a big deal. I don't want to have anyone think that doing this is expected. We should be really encouraging those that are taking the tube feed, in particular, those that have been, a little bit more resistant to it. There will and have always been those clients that are very inclined towards the tube feed. The tube feed feels like a consistent, controlled way to restore weight, right? To get to that weight that they think they need to get to, but it feels more safe because it's through a regimented formula. In addition, it doesn't force having to face a lot of the foods, which can be a strong fear. So this is why we don't want to immediately jump to the tube. We want the tube to be a last resort form of support in specific situations. In that instance, again, I want to recognize that this can be very fearful. There can be some pain and discomfort with just the actual process of getting the tube in place. It's uncomfortable. They're not going to be able to stop the food, essentially. I mean, of course, they can refuse to have the pump turned on, which takes the supplement into the tube. But once they've agreed, at that point, we need to start using it. So let's get to it. But all of those are emotions and thoughts and fears that we need to take into consideration when we're working with these clients, whether it's from a medical, a clinical, a dietary, or an administrative tech position. I always find it's really helpful to just talk them through this process, and that can be a really great way to support them. Make it as specific to them as possible and their treatment projections, meaning how well have they done, or what have they continued to struggle with, and what are you working towards together? So the more that you can demonstrate how this tube feed is a support to them, then the more they're going to be inclined to consider it as an option. Some key points: it offers a very balanced nutrition. It is going to be a little bit more gentle on their GI tract potentially. It allows the body to kind of be getting that 24/7 support to heal, even during times of rest. And for most, it can help to reduce a feeling of fullness potentially. For some, it creates a greater feeling of fullness. So it can go either way there. The next part, and this can be done through nursing also, but through clinical and nutrition and support staff, is to explain to them what they can expect with this process. So of course, they're going to have a small tube that's going to be inserted through one of their nostrils. And then they're going to do a lot of swallowing, and there's going to be some discomfort as it's gently encouraged down their esophagus. And then once it has been placed, the end of the tube will come out of their nose across their cheek and hang over their ear, where they'll have like a little port that can get connected to the tube. And then we'll use some medical tape to kind of tape that tube out of their way so that it's not as disruptive as it needs to be. Um, so with that said, there will be oftentimes some rubbing and discomfort in whatever nostril the tube has gone into. There can also be some rubbing and discomfort in the throat, and the upper throat usually is where that happens. And we do have some things in place to help support that, some throat lozenges through nursing, and we can do some different teas and warm beverages that can help to soothe the throat, in particular for those first few days. Again, always emphasizing that this is not a long-term solution. We're not just going to give you a tube feed and then you're in recovery and you're on your way. This is a temporary, intentional support tool. Even having a tube feed for a couple of weeks can really make a significant difference, and not just in renourishing the body, but also in collaboratively turning on that brain, right? Again, this is not simply about weight gain. I just want that to be really clear. It is about getting them into a body that is in a healthier place than they currently are in their eating disorder. So if that requires weight restoration, then that's happening, but it's also full body renourishment. Currently, we are going to be using the Kate Farms brand, and so I just wanted you to be familiar with this. The development of our current formulary on a handout is in progress. But there are a few different ways that we can offer tube feeding support. So just to let you know what those are, the first is a constant run. So anywhere from 21 to 24 hours would be considered essentially a 24-hour tube feed, meaning that they are connected to the bag and the pump throughout the entire day. For those clients, they will have a pole that is on wheels that has the bag and the pump on it, and they will have to take that pole everywhere that they go. So you can see how that's a pretty intensive process and a constant reminder you're getting your food. But necessary and helpful for some, just not always the most ideal. The other thing could be PM feedings. So they're eating throughout the day, the tube is just taped up, they don't have a bag, they don't have a pole, they don't have any of that stuff, and they're eating, and then at night, after they're getting ready for bed, they're hooked up and they get, you know, a 10-hour feeding in while they sleep. So that's an ideal option. Another could be some bolus feedings where as an enhancement of a meal that they've had, or even in between meals and snacks, we could do a few ounces bolused in here and there. I think that would happen a lot less commonly, but it is an option. Again, I had already mentioned there is a potential for an occasional peg tube option, but we wouldn't place that. That would be something that would come to us. But again, not a big worry. I'd like to just finish by asking that you take the next 15 to 20 minutes to head over and look through these two links. The first is a really good overview article taking a look at some of the information I covered and some additional information from the Gaudiani Clinic. Dr. Gaudiani is MD and does amazing work in this area and is talking through that tube feed process a little bit more in detail. In addition, I found this client testimonial kind of talking through their own, I believe it's a female, but I don't want to say that, their own decision to take the tube feed and kind of how that was hard for them and why they were glad they did it. And I always think it's great to hear it from that first person perspective. So again, if you have any questions about what we do, you can refer to our policy. You can talk to a dietitian. You can talk to myself, the nutrition director, or you could also speak with nursing. Thank you so much for your time.